an expansion of critical care beds at Hartford Hospital. Tell us about that.
Yeah, absolutely. So, one of the challenges we saw in this entire response to COVID was critical care space. And with the commitment that Hartford Healthcare has to the community of Connecticut, and specifically Hartford Hospital to Hartford, the Hartford community, is to expand our capability and our availability and our access to care. And this will be a significant move in that direction. Not just for response to COVID and other pandemic disease like COVID, but with critical care in general, with care in general, we know it's a needed resource, and it's something that we're committed to ensuring that it's available to the community.
So how essential is it to have those additional ICU beds, and when will they be up and running?
So August of next year, I'm being told that we should have availability to use that space, that clinical space. How critical it will be. So a few things. So as we move to the new normal, I think the significance of this, showing that there is progress in a time when there's significant challenges, I think it shows the community, and it shows not just this community but other communities, that with good planning and with exceptional community response, we're able to do this. So we're able to commit and to keep a commitment that we had to the state of Connecticut and the Hartford community, by the fact that we had significant planning and a significant collaboration with the Hartford leadership, with our leadership in Hartford Healthcare. So it's pretty significant.
You guys have been healthcare heroes. All right, one final last question. Given the downward trend here in Connecticut, is it likely we could experience that surge in the fall? What are your thoughts on that?
So I think if I have a penny for every time that question's being asked. So I think our numbers right now, so if you look at the numbers over the last few months, so in time when we had over 400 cases, and now within the system that we have less than 20 cases. So we're looking very good. And as you said, the positivity rate in Connecticut is exceptionally well, one of the best in the country. So we have some very good things that are going for us. And we see social distancing is working. We see the opportunity to open was done well. And what we see, the time period, the incubation period after the significant decisions to open, some of those incubation periods have passed with not many upticks. So I would say we're on the predictive is looking very, very good. I expect to see some changes, some uptick, but I don't think it's going to be anywhere close to where we were a few months ago, and that's very encouraging.
Okay, Keith Grant, thank you very much for being with us. We appreciate your time.
Absolutely. Thank you for having me.